Every day in Russia, hundreds of people get implants. Some lose a single tooth, others lose an entire row of teeth. People save up money, go through surgery, endure pain, wait 2 or 3 months for everything to heal, and are confident that their problem is solved for a long time. But after a year or two, complications begin, and sometimes even a second surgery is needed. And all this happens because they weren't told the most important thing, that implants are not suitable for everyone. In this video, I'll briefly explain when you should get an implant and in which cases it might not take. First, let's figure out what an implant is and what it consists of. It's what's called an artificial root, which will support our future structure or our future tooth. It is placed directly into the bone. If I turn it like this for you now, so for example, our patient is missing a tooth, we can easily place an implant, and no one except our patient will see or notice it. After 2 or 3 months, or in rare cases after 6 months, we place a special connector on it called an abutment, which is screwed directly into the implant we've installed. The future crown is placed directly onto the abutment. This is what implantation is. What do you absolutely need to know before getting dental implants? The first thing is, of course, the healing period. After the implant is placed, we need to wait before making the tooth is 2 to 3 months, or in rare cases, up to 6 months.
You mentioned on average implant healing takes 3 to 6 months. What determines this time frame?
For the implant to take hold well, in everyday language we say take hold, but in medicine it's called integration. This means that osteocytes, which are small bone cells, begin to grow into the threads of the implant. They actually grow right into the threads. And it's thanks to this process that we achieve fixation. So initially, when we screw in the implant, there is no such connection, yet the implant is held in place only by the threads. Then, gradually, these osteocytes, the bone cells, start to grow into the threaded connections. Another important thing to know before implantation is that, of course, you will have to go without a tooth for some time. So after the implant is placed, you will have to go without a tooth until it integrates.
If I'm missing my upper central tooth, the one in the middle, does that mean I'll have to go 2 or 3 months without a tooth?
There are different situations. Sometimes we place the implant and immediately put on the abutment, or let's say the healing cap, and we can make you a temporary plastic tooth to cover the gap. That is possible. But sometimes we can't immediately make a restoration on it. In that case, we also have several options. Option number 1, you will go without a tooth. Option number 2, the doctor tries to come up with something like an adhesive bridge where we attach a kind of bar to the neighboring teeth, and the doctor creates an artificial tooth right on that bar. You should be prepared for the fact that you really might have to go without a tooth for some time. You should also be prepared if you decide to get an implant for significant swelling, swelling of the mucous membrane and visible tissue swelling. Of course, the intensity and severity of the swelling depend on various factors, both on the individual's body and on the specific nature of the procedure performed on the patient. The swelling reaches its peak on the 3rd day. So after we've placed the implant, the swelling is at its maximum on the 3rd day. But after that, it gradually subsides. In fact, in my experience, there's a clear trend. The more intense and severe the swelling, and especially the bruising, the better the healing. The stronger the body reacts to the intervention, the better. Because during any surgery or trauma, the body directs not only its reserve capabilities, but all its protective resources right to the affected area. The healing is really good as strong bone callus forms, especially after bone grafting. We take an X-ray, and after just 6 months, there's already a huge amount of new bone growth. You also need to be prepared before the implantation procedure and before deciding on implantation for the possibility that the implant might not take. Why might an implant be rejected? Well, actually, there are quite a few reasons for that. The first reason is the individual characteristics of the body, when it does not accept or does not tolerate the alloy titanium itself or the small impurities that remain in the titanium. Even though modern titanium is now purified from additional metal impurities, which, by the way, used to be a factor in rejection. The second reason is, of course, any additional already existing comorbidities. At the end of this video, I'll tell you exactly which diseases make dental implantation impossible. If the implant is still rejected or fails to integrate, or in simple terms falls out, in this case, of course, there's a specific protocol that must be followed. We contact the manufacturer and order additional tests. As soon as we understand the cause, we calmly reinstall the implant. We simply take it out and put in a new one. We observe again to see what happens. You can reinstall the implant or place a new one on the very same day. Most often, of course, an implant will never just fall out of your mouth like that. But we can see it on the X-ray. You come in, we see this problem on the X-ray, and basically we unscrew it ourselves, clean the area, and place a new one if possible. Sometimes, on the contrary, we unscrew it, clean it, and then let the patient go for 3 to 6 months so everything can heal and form properly. And then after 3 to 6 months, we place a new one. I would like to emphasize, very often, even when coming to our clinic, the patient has already been to more than one clinic or seen more than one doctor, but there is still no full understanding, not just of the price itself, but it seems to them that they need to pay everything here and now. And then indeed, the total amount seems quite overwhelming and intimidating. When we explain that you don't have to pay the entire amount at once. First, the patient pays for the implant placement, and then we let the patient go for 2 or 3 months without any worries. Then they come back, pay for the placement of the healing abutment, and only after that, in about 2 to 4 weeks, they will have the crown placed and pay for it. So essentially, the total cost is divided into 3 payments over the course of 3 months. Of course, I understand that situations and clinical cases can vary. Everybody is highly individual, even unique. So if you still have questions, write them in the comments or join my Telegram channel. I'll be happy to answer them. The link is in the description. I've told you what to prepare for before the implantation procedure and what to expect. And now I'll tell you about the less obvious advantages of implantation. For me, the main advantage of implantation is, of course, the so-called preservation of the neighboring teeth. So if we are talking about this kind of structure, or rather this kind of clinical case where one tooth is missing, in the past we would have had to place a bridge and grind down the 2 neighboring teeth to replace this defect. But now, thanks to implantation, we can simply place an implant, put on a crown, and our 2 neighboring teeth remain completely untouched, healthy, and will last for a very, very long time. That's why, for me, this is one of the main advantages. The second advantage is the high and predictable success rate, which is very high in percentage terms. In fact, it's really between 98 and 99.8%, and can you imagine? Another advantage, of course, is comfort. If we compare removable dentures that a patient wears with implants, the difference is enormous. With implants, we can make a fixed, non-removable structure. This means the patient will be as comfortable as possible and won't have to worry about anything falling out. Thanks to implantation, we can stop the process of bone atrophy or bone loss. When there is no load on this area, the bone can become softer and indeed it starts to recede. That's why when we place an implant, our bone starts to function. In other words, it recognizes that there is a load on it and bone loss does not occur. The next point is the guarantee. What does that mean? For each implant, you are given a special certificate with an individual identification number. There is extensive coverage worldwide, and you can always take this certificate with you and show it at any clinic in the world. Here, I have this implant. Here is its number, and you will be assisted in any country. Another advantage to add to the list is speed and durability. The procedure of installing even a single implant like this takes at most 20 minutes. And as for durability, of course, with proper care and regular checkups, at least once a year, ideally every 6 months, this implant will last you a lifetime. Who is definitely not a candidate for implantation or getting implants? First and foremost is diabetes, specifically its decompensated form, when medications are no longer effective in controlling your blood sugar. If you have such uncontrolled diabetes, implantation is not suitable for you. The next contraindication is cancer. That is, if a patient is under the care of an oncologist, implantation is contraindicated. The next contraindication for implantation is patients who are taking so-called bisphosphonate medications. These medications are taken by patients during the treatment of osteoporosis and also in the treatment of cancer. Another contraindication is immunodeficiency conditions or diseases, such as AIDS. And the final contraindication is age under 18 years. It may seem completely unexpected, but for patients who are under 18 years old, and in exceptional cases even up to 21, implants are contraindicated. This is because the formation or final development of the dental and jaw system is still ongoing at that age. Be sure to tell your family and loved ones about these contraindications. Or better yet, share this video so that as few people as possible make mistakes when getting implants. And I would be very grateful to you. Give this video a like if it helped you learn more about implants and make the right choice. Subscribe so you don't lose this video. Take care of yourself and your loved one.